The future of insurance is set by what takes place in adjacent industries. And consequently, the future of health insurance is determined by what takes place in the health domain. And that's why we think it is essential to learn how the largest players in health think about the future and what their strategies are. Next on DIA Primetime is Fernando Arnaiz. Fernando is the health system strategy leader at Roche. The blue-chip global pharmaceutical company is a pioneer in diagnostics, focusing on advancing science to improve people's lives. Combining pharmaceuticals and diagnostics under one roof have made Roche the leader in personalized healthcare, a strategy that aims to fit the right treatment to each patient in the best possible way. Many insurers think they spend a lot on innovation, not compared to Roche. Every year, Roche invests around 9 billion in R&D. This is among the highest R&D spends in the world across all industries, because Roche realizes that innovation is their lifeblood. We're therefore extremely excited that Fernando accepted our invitation to tell us more about their bold vision, including all their initiatives in the Insurtech and insurance space.
Hi everyone, my name is Fernando Arnaiz and I work in Roche Global. I'm very glad to be here with you today and be part of this event, and I'd like to thank the organizers for the invitation. The team that I lead is responsible for Roche Global strategy on different innovative funding and financing mechanisms, and we also coordinate strategic alliances and partnerships with different public and private sector partners. Today, I'll be sharing with you our experience and vision on how we are redefining partnerships between pharma and insurance companies. I'll split my talk in 3 sections. The first one is going to be around what's Roche's vision and strategy and the importance of partnerships with insurers. The second one is going to be around innovative insurers players, and I'll be referring to Fintech and Insurtech. And the third part is going to be around how we are exploring new avenues for innovation with insurers. Great, so let me start by telling some things about Roche. Roche is a global pioneer in personalized healthcare. We have 2 divisions, one is diagnostics, the other one is pharmaceuticals, all under one roof, which is quite unique in the healthcare industry, and that gives us the possibility to create integrated solutions for patients across the entire spectrum of healthcare, going through prevention to diagnosis to monitoring and treatment, of course. In 2019, Roche invested 10 billion in research and development. This is amongst the top investors in healthcare across different industries, including, for example, Google. But nothing really makes sense if our innovation is not reaching to patients, and what we are observing is that unfortunately not everyone has access to the latest healthcare, and far too many people are either having no access at all or having access to basic level of healthcare. And we in Roche are addressing these multiple challenges from multiple angles, covering diagnosis, healthcare capacity, and funding, for example. So our team works collaboratively across different health systems to find or identify new ways to fund and finance access to innovation. And in doing so, we work with a broad range of stakeholders and partners. But we think we have a very pragmatic way to approach this, as we're constantly looking at transformative partnerships, what are the partnerships and the partners that can help us accelerate solutions. We're looking at innovative pilots and approaches, and we are above everything trying to shape solutions that can be integrated within health systems and can be scaled up internationally and taken or adapted by other countries across different geographies. And what I'm sharing in this slide is the spectrum of stakeholders with whom we traditionally work with. You can, of course, imagine that we work a lot with governments and policymakers when it comes to funding and financing strategies and why not reforms. But we also work with providers and think tanks and academia. We publish a lot, and we're very active in the space, as I told you, of different solutions. Over the last 10 years, we've been working intensively with insurance and reinsurance companies. And what we are observing recently is that there is a promising area in the space of Fintech and Insurtech And that's why we are now investing heavily on exploring how we can leverage those platforms and opportunities to address funding challenges. So why private insurance and why Roche works with them? Well, there's a couple of reasons that I'll try to summarize right now. The first one is that fundamentally private insurance is a sustainable funding model that offers financial protection for patients. The second one is that we know that private insurance has been growing over the last years and will continue to grow in both developed and emerging markets, with different solutions and products being offered to high and low income clients. And the third one, which is to me a very important one, is that we know that governments are eager to work with private insurance to shape solutions that help them advance their universal health coverage programs to either supplement or complement what they are currently offering. So that opens up a new layer of opportunities for us to work with private insurance and governments and advance healthcare coverage. Over the last 10 years, we've been working with different insurance and reinsurance companies and help them develop different solutions. Within these years, we acquired a lot of knowledge and experience on basically how to work with them to either maintain their premium levels or manage healthcare costs, or even to differentiate in the market by offering insurance coverage for new innovation. So now we know how to tailor our support according to the insurance or reinsurance needs. And I'll give you a couple of examples of how we're currently working with them so you can understand more about this. First, insurance access to Roche scientific expertise, and that means equipping them with epidemiology and treatment cost data. We work so they can understand more about patient flows and anything they need to design new products. The second area that we work a lot with insurance companies is to increase their appreciation of new treatment and technologies. And here we've been doing a range of things, such as providing training or education programs to, for example, Salesforce or health agents. We work a lot building bridges between insurance companies and corporates. We conducted several awareness campaigns, developed different patient materials. The third area is around efficient patient management. And here we've been collaborating between insurers and several providers and other stakeholders. We provided guidance on treatment adherence and different treatment protocols. And lastly, the point that I was mentioning around working with governments. We have been working a lot with private insurance and different governments to try to accelerate the development of different programs to increase patient access. So the output of the work with insurance and reinsurance companies is reflected in the slide that I'm sharing with you right now. And I wanted you to know where are the countries that we're currently working with, and also so you can have an overview of some of the partners that are working with Roche at this moment. As you can see, we developed more than 40 solutions in approximately 30 countries. Whereas I cannot go deep into all the examples, I did want to mention at least 3 so you can have a sense of the different solutions or approaches we took. The first one is China. In China, we developed different breast and oncology insurance products, and we did that with different insurance and reinsurance companies. That's where, for example, the work with Swiss Re started, and this was roughly 10 years ago, if not more. The work evolved, and we also put in place different public-private partnerships. We worked with the local government, and that evolved very well throughout the time. The second example is Dubai in UAE. And this example is quite different. This is a public-private partnership with the Dubai Health Authority, AXA Insurance, and Roche. And in this case, we're talking about the creation of a central cancer fund throughout a mandatory insurance product. That is also still ongoing. That was launched roughly 2 years ago, and it provides coverage to 4.5 million people. The third example is Mexico. And now we're talking about a different thing. This is genomic profiling platforms. And we worked with almost all the insurance companies in Mexico, and 90% of them approximately are now offering coverage to genomic profiling platforms locally. Right, so why Fintech, why Insurtech, and how we are working with them? So first of all, due to its digital nature, we believe that Fintech has the capacity to make financial services more accessible, more affordable, and more inclusive to people. We believe that Fintech in the short to mid-term has the potential to bring substantial impact in the healthcare space in at least one of the following dimensions that I'll be mentioning to you right now. First of all, it can expand the health financing base by increasing connectivity with digital users. You can strengthen health system resource pooling capabilities, and why not enable risk transfers amongst groups. The second point is that it can increase financial protection, which can lead to a reduction of the out-of-pocket expenditure. The third point is that it supports data-driven environment, and we believe that meaningful data can be used to expand or enhance new products and new services that can be offered to different segments of the population. And last but not least, we believe that Fintech can foster innovation in healthcare. We're talking about multiple stakeholders. Some of them are new into the healthcare space, working all together. That can definitely open up new collaboration opportunities, and why not new solutions. Roche is now partnering with different fintech companies as well as online and digital insurance companies to accelerate the design and launch of promising digital mutual aid schemes and or crowdfunding platforms, as well as different insurtech models that can address financial shortfalls present in many health systems. Therefore, we have created a number of pilots in different countries such as Kenya, Nigeria, Singapore, and China, of course. We believe that the findings from these initiatives will reinforce future developments and new pilots. So from the global perspective, we will continue to drive connection and co-creation between Roche and different fintech and insurtech global, regional, or local companies. Okay, let's get into the last part of my talk, in which I will be referring to how we in Roche are exploring new avenues for innovation with insurers. And I thought of mentioning four big things. The first one is precision oncology, or personalized healthcare for oncology. And here we're talking about leveraging new technologies such as comprehensive genomic profiling that can help understand the patient's tumor profile and identify targeted treatments, which can bring many benefits for patients but also for payers. The second area is rare diseases. In rare disease, we're not talking about one disease. There are multiple of them, and many treatments are going to be launched in the next couple of years. So we clearly see this is an area where insurance companies and pharma will be working together. The third one is gene therapies, and similar to rare diseases, we're not talking about one specific disease, but multiple treatments. The fourth one is diabetes. We have plenty of experience supporting different payers on disease management programs, but definitely we're seeing that this will become a more relevant area for us to work together. So there are multiple things that we are currently doing with insurance companies that are connected to these four elements. On the side of the new insurance models and new product design, we are working with some partners to try to cover pre-existing conditions such as rare diseases, or how to develop insurance for cancer survivors, for example. We are continuing to work on top-up and specialized cancer benefits. This is something we've been doing. We will continue in the same direction. On the side of rare disease and gene therapies, we are working with different partners on new payment models. Both rare diseases and gene therapies are going to require a new thinking in terms of payment models, and we're currently working on that as well. For diabetes, as I mentioned, we're working in several countries such as Mexico on disease management programs and to try to combine the dialogue between governments and insurers partners on this area. It's one of the most interesting topics that we're involved. Regarding new distribution channels and partners, we are working with reinsurance companies, especially in the space of rare diseases and gene therapies. They are very interested in new payment models, for example. With brokers and within the employee benefits area, this is something we've been doing for a couple of years. We'll continue to work in the same direction to try and incorporate new products, new treatments, and new disease areas into their current coverage. As I told you, the fintech, telco, financial institutions space is one that we will continue to explore, and we're really trying to advance pilots and shape solutions. And last but not least, I put public-private partnerships. This is a relatively new model. We don't have a lot of examples, but the ones in which we were involved are indicating that this is a very promising area. We are seeing that governments are more and more open to work with us and private payers. So that's why I think definitely this is an area or an avenue for innovation between pharmas and insurance companies. Good. This is the end of my talk, and I really hope you find it interesting. If I had to summarize these last minutes into only a couple of words, Roche is deeply connected with insurance and reinsurance companies. We're looking at new areas of collaboration with you and new partners. We're getting into new spaces. We really want to multiply our engagement opportunities and have a dialogue on how we can shape together new solutions. So if you're interested in having a discussion with me on new collaboration models, or you found that some of the examples that I shared are connected to your day-to-day work, or you find some examples useful, don't hesitate to contact me. And again, thanks very much for watching this video, and I wish you a good day.